Joining me today on our Health Roundtable to discuss diabetes in the minority community are Dr. Erica Gonzalez, endocrinologist at the Harris Health System and associate professor at Baylor College of Medicine, and Tarah Davis from the American Diabetes Association's office in Houston. I'd like to thank both of you for joining me today. First of all, we hear a lot about diabetes, but give me a definition of diabetes. What is diabetes, Dr. Gonzalez?
Okay, so diabetes is characterized by high blood levels of sugar, also by relative deficiency of insulin and peripheral insulin resistance. That is the definition of diabetes.
And there are actually two types of diabetes, or are there more?
Yes, the two main types of diabetes are type 1 and type 2, but there are other subtypes of diabetes that we have learned about through time and through different studies. However, when we think of the main two types, type 1, we consider it an autoimmune disease. Basically, the person is born with antibodies that would attack their own beta cells in their pancreas. And remember that the pancreas produces insulin to help regulate your blood sugar. So when you create antibodies that destroy those cells, you don't make insulin anymore. So it's called so basically you have a complete deficiency of insulin. That's type 1. And so that requires insulin to treat it. And then we have type 2, which is commonly called adult onset diabetes, and it's because it usually occurs after your third decade of life, and it's associated mainly with lifestyles or environmental factors, and also with genetics.
Ms. Davis, I want to talk more about that. How does one get diabetes?
Well, you get diabetes, you usually have to be diagnosed, but you can get type 2 over a period of time of not being healthy, not eating healthy, living a sedentary lifestyle, and also if it is in your genes. If your mother, father, brother, or sister have it, your risk factor goes up greatly.
Let's talk about the disparities. There was a major report done in 2003 that talked about the disparities as it relates to diabetes in African Americans, Hispanics, and whites. Let's talk about disparities here.
Okay. If lifestyle trends don't change by 2050, 1 in every 3 of our children will have diabetes. But if you're African American or Hispanic, it's 1 in every 2. So the disparities come in with culture. One of the things that we love in our culture is food. We all gather around food. And in those ethnic groups, a lot of times their food isn't very healthy. And so that plays a huge role in your risk factor going up. And also if your environment and your traditions are passed on from generation to generation, a lot of times they're not questioned.
Let's talk a little, Dr. Gonzalez, about medications. A lot of people in the minority communities are afraid of drugs and the side effects, because there are side effects. Let's talk about having to deal with that.
Okay, so I want to emphasize that diabetes is a chronic and progressive disease, so it requires treatment. And so when we're talking about it, we need medications to treat diabetes, and they will improve those blood sugar levels that we were talking about initially. The different types of medications have been on the market because they have been tested and they have proven to help regulate your blood sugar. People are afraid of medications because of the side effects, but side effects most of the time are mild and they disappear with the use of the medication. Those are the ones that people hear most commonly, and we usually even warn the patients before they start on the medication what they can anticipate.
Diet is important. What should you throw out?
Carbohydrates, and basically those carbohydrates are the ones, the bread, the rice, the starchies, the starchy vegetables like your potatoes. You don't have to cut it out completely, but eat less of it. Portion is important. Half of your plate should be your non-starchy vegetables.
Exercise?
Absolutely. I think physical activity is very important, especially because when you have diabetes, you have peripheral insulin resistance. That means that your cells don't respond very well to that insulin signaling. And when you exercise, your muscle cells, because you're increasing the amount of muscle cells, and you respond a lot better to insulin, and that therefore you can regulate your sugar a lot better too.
I should also point out that you can die from diabetes.
Yes.
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 Right.
Absolutely.
Yes.
Absolutely.
Okay.
I usually tell patients this is kind of like a silent disease. It doesn't kill you right away, but it can kill you over time. So that's why it's so important to treat it and diagnose it soon so that you can take
Good. I want to thank both of you for joining us. This is a discussion that we need to continue. We will be back after these messages. Stay with us.